Thank you. I'm going to have to go back in the queue, but even this morning, just being bombarded by emails, questions, phone calls, people who are frustrated, angry, scared, disoriented. And so I want to attempt from 30,000 feet to explain the overall picture. This is more for our residents, and I want to ask the team to correct me if I say anything wrong. So here's the situation. Federal government is working directly with Pfizer and Moderna to distribute the vaccines to the states. The federal government strategy has been fuzzy and has not been transparent. And the Biden administration is working on accelerating both a better distribution plan and hopefully help those two companies and the others come online produce more vaccines. States are responsible for devising their own strategies on how they're going to disseminate the vaccines to their constituents. The states are responsible for disseminating the vaccines to local county governments. Maryland has been receiving, on average, approximately 70,000 vaccines, per week. And they made the policy decision early on, and as Dr. Kroll noted, we've only been in this a month, but that the distribution of those vaccines would be consummate with the population of each of the counties. Montgomery County's population is between 18 and 20% of the state. So we've been receiving on average about 18 to 20% of the vaccines made available to the state. Here's the problem with that, because on the surface, that makes sense. Talbot County, which is leading the state in the number of people vaccinated, has a population of 37,000 people. The city of Rockville has a population of 67,000 people. Montgomery County has over 60,000 residents over the age of 75. Talbot County has one hospital, and we have 6, along with all of our other medical and healthcare providers. And so even really, getting as a percentage of the population, Talbot County has been able to move on to 1C. And so when the governor makes an announcement in a press conference that the state of Maryland is moving to 1C, it is true for those smaller counties that have fewer people that they have been able to move forward with 1C. Montgomery County has not, because we have a significantly larger population, a larger population of people in the 1A category, a larger population of people in the 1B category. And we are among the best in the state in being able to turn around the vaccines once we receive them to get them into people's arms. But because of the mixed messages that our constituents understandably are confused by, they continue to wonder why Montgomery County has not been able to more robustly move forward and be at 1C when all of these other counties have been able to. How am I doing so far? Is that accurate so far?
Yes, you are very accurate.
Okay. So now here's the new challenge. We are being able to disseminate this through not just the hospitals now, but also our own administration. We're adding Giant and the CVSs and the pharmacies, all good news. But because we don't exactly have a centralized registration system, and because the registration system we in fact do have is easily spread to other people because it didn't have the controls in place, we now have what feels like the Wild Wild West, in which people are signing up wherever they can, in as many places as they can, because they are scared, because they are disoriented, because they are hearing messages from the governor that we are on to 1C, and that is gumming up and creating a bottleneck across the board and confusion among all of our residents. So far, how am I doing?
Again, you are very accurate.
Okay, so where we are right now is the good news. The county executive had a successful meeting with the governor yesterday. The governor's comms team announced that 18,000 additional vaccines were going to be made available to Montgomery County. So I want to confirm if that is actually in fact true. That's going to be my question in this first round of my queue. And if it is true, how are those 18,000 going to be distributed? Are they going to be distributed through the hospitals? And I understand we don't care, and I get that. The important thing is we just get them out. But what is the plan for those 18 additional thousand that we're going to receive, if in fact it is 18,000?
So I think and others can chime in on this as well, is that the number that the governor's office tweeted out yesterday was inclusive of the 9,000 additional doses coming from the Johns Hopkins allotment. And as we laid out, we met with them this weekend. They reached out to us on Saturday when they received notification that they were receiving those doses. And we engaged in conversations on Saturday and Sunday and ongoing conversations about how to allot those doses within the community. And so their key areas that they're going to focus on are folks who are 65 and up. And they have had their own conversations. We've helped connect them with their school systems to discuss creating a system where we can bring in educators and educational staff to also be able to utilize those doses in the first week. My understanding is that they have received that allotment for this first week. I don't think that they have received confirmation as of yet about following weeks, but the expectation is that if everything goes smoothly, there would be further opportunity to increase the dose or to continue to provide them with doses to be able to support the county by providing extra doses to other folks. I think was that.
It does. You nailed it. Final comment, and then I'd like to be put back in the queue, Mr. President, just really quick. My colleagues and I, a letter is going to be distributed to all of my colleagues. We'd agreed last week we're going to send a joint letter to the governor with a series of follow-up questions and concerns that have been raised by constituents. I want to thank HHS for helping us, and Linda McMillan and my staff and my team for working on the production of that draft letter, which all of my colleagues will receive this afternoon. Our hope is to send that letter tomorrow to the governor, following up with very reasonable questions of our Secretary of Health to clarify some of the issues that we don't have control over here in Montgomery County. And we do, again, appreciate the governor's very productive and positive meeting with our county executive yesterday. It's something to build on, but there's obviously a lot more that needs to be done. I'll come back with more questions, Mr. Council President, in the queue, but I'll defer to my colleagues for now. Thanks.